In this PowerPoint, we are going to talk about the post-traumatic stress disorder, shortly called PTSD. Here we also will talk about the treatment option for PTSD. First of all, what is the post-traumatic stress disorder? So, after experiencing a psychological traumatic events, the individual is prone to re-experience the events and have the recurrent and also intrusive dream or flashback. Example, if any events occur in our life, definitely bad events, it would be difficult for us to forget. I want to forget, but it is hard to forget. So the patient who have or the person who diagnosed by the post-traumatic stress disorder, when you take the history, they must give you any kind of exposure history. And this exposure to a traumatic events. If you ask me, what is traumatic events? Example, like sexual assault, rape, physical abuse, or any kind of military combat. This exposure to the traumatic events that can cause some kind of manifestation, and we called the sign and symptom, right? Before to go in the sign and symptom, let me discuss about the what are the underlying cause of traumatic stress disorder. What are the stressors, or what are the bad exposure to the patient, like natural disaster. Something is happened and you fall in the disaster, and then it is difficult to forget, like terrorist attack, combat experience like a war, any kind of road traffic accident, rape, crime or violence, sexual, physical, even emotional abuse, or re-experiencing the events as flashback, right? So now question, what are the sign and symptom the patient explained to you? What is the manifestation? Like patient, when give you the history, they said, I want to forget, but it is come in my mind, in my brain all the times, right? And I am afraid something same will happen with me. Flashback of the events, or patient explain very distressing dreams or sleep disturbance, nightmare. When they fall in sleep, a bad dream came in their mind. And it is very difficult for them to get the concentration, right? So poor concentration and avoidance of activity that trigger the memory. Patient most of the times complain of insomnia or sleep disturbance. Patient complain of anxiety, irritabilities, detachment, and this detachment from others, or hyper vigilance or exaggerated startle response. Also, they feel of guilty or negative self-image. So if I am victim, it is not my fault, but the victim can feel it is my fault. So feeling of guilty or negative self-image, they think if I will not do it, or if I would not do this, maybe I will not be the victimized. So because of this explanation, they feel guilty, right? So now go here. What are the intervention or what are the treatment option? So according to this note, they said the client dealing with the cancer, like cancer is a one kind of traumatic events, right? So the cancer patient may develop post-traumatic client, or the clients dealing with the cancer, they chance to develop in the post-traumatic stress disorder. And cancer-related PTS can occur anytime during or after the treatment. Hmm? So when we will deal with the patient who have PTSD, always cognitive behavior therapy is very important for them, or prolonged exposure therapy. What does it mean, prolonged exposure therapy? And this type of therapy combined with relaxation technique as well. Eye movement desensitization or reprocessing is shortly called EMDR. It's one kind of psychotherapy. It can help to your patient. So after the psychotherapy, if patient are not okay, we give them medication. Usually we give SSRI, means serotonin, selective serotonin reuptake inhibitor. Hmm? Or we give them tricyclic antidepressant, because most of the patient have a problem, they undergo depressive disorder, so antidepressive can work, tricycline. Other treatment option we can give, like hypo um, hypnotherapy, hypnotizing, or biofeedback.